Tonight on Nation to Nation, the Métis Nation of Ontario president says if Bill C-53 fails, her organization will pursue its own self-government recognition.
In fact, there's a commitment to reintroducing a bill identical to C-53 if it doesn't ultimately pass.
A new report finds First Nations people in Alberta are more likely to leave emergency waiting rooms without receiving treatment than non-First Nations.
So about 7% of First Nations members, just a little under 7%, versus a little under 4% for non-First Nations people.
Welcome to Nation to Nation. I'm Fraser Needham. The Trudeau government's Bill C-53 was dealt another blow last week after the Métis Nation Saskatchewan withdrew its support for the legislation. This leaves only the Métis Nations of Alberta and Ontario left supporting the bill, which formally recognizes Métis governments in these two provinces. The Métis Nation Saskatchewan says it now plans to pursue its own self-government agreement with the federal government. First Nations in Ontario and the Manitoba Métis Federations have been lobbying hard against Bill C-53 for months because they say the MNO is not a legitimate Métis organization. Joining me today to talk about Bill C-53 and what happens next is the President of the Métis Nation of Ontario, Margaret Froh. Welcome back to Nation to Nation, President Froh.
Good to see you, Fraser.
And I guess I'll have to start with the question that everyone's asking, is Bill C-53 dead?
Well, I think it's fair to say that the future of Bill C-53 is uncertain. For clarity, it's not actually our bill, it's Canada's bill, but we do want to see Bill C-53 passed, and with the removal of Métis Nation Saskatchewan, as they have requested. And I think it's fair to say there's been a lot of work that's been done over the course of the last year. As you know, the bill was introduced on the last day of sitting in June. You know, we've been through a fairly challenging committee review process at the INAN Committee, the Indigenous and Northern Affairs Committee, and we've put a lot of time and effort into that. We want to see that hard work and that effort through, and we certainly don't want to have gone through that, suffered that for nothing. So we're committed to seeing Bill C-53 passed. It is something that our self-government agreements committed Canada to introducing, and in fact, there's a commitment to reintroducing a bill identical to C-53 if it doesn't ultimately pass. But of course, we have the same option to pursue the course that Métis Nation Saskatchewan has chosen. Right now, we totally respect their decision to focus on advancing that modern treaty and seeking legislation when they're ready to do so.
Now, that said, you talk about all the work that went into it, and of course, past two readings, it's in committee, fairly late in the game. It must be kind of disappointing, I guess, for all the work that you've put into it and other people for the MNS to withdraw its support this late in the game.
I completely understand. The bill has been delayed. It's faced its challenges, and Métis Nation Saskatchewan quite rightly made the decision that they want to focus on just advancing the treaty and advancing legislation at that point in time. What was innovative about the way Canada and our three Métis governments were approaching Bill C-53 and our self-government agreements, was a commitment to upfront federal recognition legislation. That's what was unique about. Not really unique in that it did follow on a precedent from Yukon First Nations years ago. But that's what was different about this bill. So Métis Nation Saskatchewan has chosen to pursue treaty and legislation at that point in time. As I said, this is something that we fought hard for, the commitment for upfront federal recognition legislation. It's something that every modern treaty, every self-government agreement has this type of legislation. For us, it's just simply too important to ever give up on. It is absolutely about our children. It's about allowing us to care for our kids who too often end up in the foster care system and are lost to our communities. And we're never going to stop fighting for our children. And it's also about our people and our government finally being recognized and treated with respect. So that what's happened to us, for example, over the last 10 months as we've been moving this bill through the legislative process doesn't happen again. And I think one thing that is very clear is Ontario Métis are here. They've been here for the better part of 2 centuries now. We aren't going anywhere. And I think this challenge that we're facing has only strengthened our resolve. We need to ensure that we achieve that recognition that our people, our communities are rightfully deserve, so that others can't deny our history and our people again in the future.
So obviously you're still with the Métis Nation of Alberta as part of the legislation. Now that court case came down that said they had not, or the legislation hadn't consulted with other communities in Alberta. Have you had talks with them as to where they're at in fulfilling that, or how they may bring these communities into the current legislation?
Well, that decision, as I mentioned earlier, it made it very clear that these self-government agreements that we've signed are that they are solid, that they did not actually quash the agreement itself. They quashed a provision in the agreement that the Métis Nation of Alberta and Canada are now going to have to go back and address. And that's the definition provision. So there's some work that they have to do there, but we've certainly had conversations around with the Métis Nation Saskatchewan's decision to pursue the self-government treaty path. We've had conversations and we're in agreement that we want to continue to pursue Bill C-53 and see it to its conclusion, and that's possible with Canada removing the Métis Nation Saskatchewan as they've requested from the legislation.
Now, just moving to the national organization, the Métis National Council, I haven't heard a lot from them recently on Bill C-53 or just sort of the legislation in general. Were you hoping that they would be more active on the file, or maybe more supportive, or public anyway in their support?
Well, the Métis National Council, for clarity, it is comprised of the four Métis governments that make it up: the Métis Nation of Ontario, Métis Nation Saskatchewan, Métis Nation of Alberta, Métis Nation British Columbia. And in fact, in December, we just held our annual assembly and we unanimously passed a resolution in support of Bill C-53. That is the position that we have taken at the MNC. I don't believe that has changed at all. And in fact, the statement that we had from our national president was that the MNC is here to support all of its governing members, all of the Métis governments on their path towards self-determination. And in fact, I think our national president has been very effective in continue to be that voice at those times when we're, of course, during all of the work of Bill C-53, our governments are actually working every day, providing services to our people, and we're doing that work on the ground. Our national president has that presence in Ottawa and has the ability to keep in contact with folks. So it's been very effective, I think, to have the Métis National Council all standing together on this important legislation, as we will stand together on Métis Nation Saskatchewan's legislation when it's ready to go forward.
Okay, well, I think that concludes what I have time to ask anyway for time reasons, but really appreciate you taking the time to talk to us again, as always, about this legislation.
Thank you, Fraser. It's a pleasure to be here.
Up next, we'll have University of Alberta professor Patrick Mclean to talk about a new report that says First Nations people in this province are much more likely to leave hospital emergency rooms without receiving treatment than non-First Nations people. Welcome back. A new report finds First Nations people in Alberta are far more likely to leave hospital emergency waiting rooms without receiving treatment than non-First Nations. Patrick Mclean is an adjunct associate professor in the Department of Emergency Medicine at the University of Alberta and one of the study's co-authors, which was published in the Canadian Medical Association Journal. He joins me from Edmonton. Mr. Mclean, welcome to Nation to Nation.
Thank you for having me.
So it appears, I guess, from your study, obviously, that systemic racism appears to be a major factor in why First Nations people are leaving hospital emergency waiting rooms before they should. How, in the study, how were you able to isolate this as a factor on its own?
Yeah, so we knew from previous research that emergency care is a very important service for First Nations members, but is a common place where negative experiences are reported in the healthcare system. And so patients have talked in previous reports about avoiding the emergency department, expecting discriminatory treatment, driving further to avoid the nearest department and go to one where they think they may receive better care. And providers have also told us that anti-Indigenous biases and stereotypes impact care. In this study, we dug into the issue of leaving at any point in the emergency care journey. So from the waiting room, while waiting to see a physician, maybe after seeing a physician, but waiting for test results or admission to hospital. And we found that the rates of leaving are higher for First Nations members. So about 7% of First Nations members, just a little under 7%, versus a little under 4% for non-First Nations people. And then we were curious if anything like the types of hospitals people are going to could explain that, going to more rural hospitals. Could it be differences in ages in the populations? If younger people were more likely to leave. Or could it be the types of things people are going to the emergency department for? So we examined all of those factors with the emergency department data we have, and we saw that no, all over the province, all different hospital types, different conditions that we looked at, First Nations people are leaving more than comparable non-First Nations people. And then we conducted sharing circles led by my colleague Leah Bill, and we heard the stories that would cause people to leave.
So I think we talked about this a little bit before in the pre-interview, but often in the stories that we cover, Indigenous people tell us that it's assumed drugs and alcohol are at play when they go into an emergency room at a hospital. Did you receive similar feedback in your study?
Yes, absolutely. We heard that one of the common stereotypes operating in emergency departments is around the idea that Indigenous people are substance using. So that's problematic, could lead providers to see substance use when that's not the case, or could impact care where someone does need substance use treatment. But some of the specific stories people told were around that, around having a concussion, and they believe that they're using substances, want them to talk to an addiction counselor, and so the patient's going to leave in that case.
Now, is it the case that First Nations people often wait longer to be assessed in general than non-First Nations people?
And we didn't look at wait times. They would vary all over. Wait time in a rural hospital is very different than a wait time in an urban hospital. Depends on the crowding in the department. But we did look in a previous study at triage. So triage is when the nurse takes the symptoms and the medical history and prioritizes how urgently a person needs care. And so in that previous study, we did find that First Nations people are less likely to be prioritized for care than comparable non-First Nations people. And certainly in the sharing circles, people talked about the perception that they are being made to wait longer than people who aren't First Nations and don't seem to be as sick. The previous triage findings suggest that that may well be the case, that people are being made to wait longer.
Now, I'm sure that you heard many alarming stories. Is there one, though, in particular that maybe really stood out and you found the most shocking?
Well, that's a good question. The one that stays with me is a person talking about presenting to emergency department when they were feeling suicidal and waiting and feeling that no one was going to help them, and so choosing to leave the emergency department. And they say that they don't go to emergency department when they have those feelings anymore. So that's a really tragic story.
Okay, and what about, were you able to determine whether or not, obviously these are negative experiences of First Nations people, whether they're less likely to seek any sort of care in a hospital after having an experience like this?
This isn't something we've looked at in our study. There is research that suggests that Indigenous people who have experiences of discrimination in healthcare are less likely to have care later. In our study, what we saw is that First Nations people are more often coming back within 72 hours of leaving without completing care, so to try and complete that care. And for both First Nations and non-First Nations, about 1 in 20 people needed to be hospitalized after they left and then came back. So we really think that this leaving is interrupting needed care.
Now, maybe you could talk a little bit about some of the improvements you think that hospital emergency waiting rooms could make in order to serve First Nations people better.
First Nations co-authors on the study have talked about the need to have Indigenous-led services and Indigenous spaces, so patients may feel more safe in Indigenous facilities. I think otherwise, non-Indigenous people in the healthcare system need to be listening to First Nations leaders and health directors who know what's happening for their members and could direct improvements.
Okay, maybe one last question too is the have you had, I guess you probably haven't any feedback, but how much resistance or openness do you get from healthcare, the Alberta healthcare system, or healthcare providers that they're interested in actually improving this service to First Nations people?
Yeah, I hear actually from many nurses and physicians working in the system that these findings are valuable, that they want to act on them. So I know that colleagues are using them in medical education, in grand rounds for continuing education for physicians and nurses. We know that we hear that they're being taken up by working groups in colleges. So we do think these findings are having a great impact.
Okay, well, we're going to have to leave it there, but once again, thanks very much for joining us today.
Thanks very much for having me.
Up next, we'll have Hill Times columnist Rose LeMay talk about the RCMP, the force's troubled relationship with Indigenous people, and what might be done to improve this relationship. Welcome back. A new report out of Yellowknife finds homeless Indigenous women in the city simply do not trust the RCMP. This information is not exactly new, as Indigenous people have historically had an adversarial relationship with the Mounties. Hill Times columnist Rose LeMay writes about this troubled relationship and how it might be improved in her latest article. She joins me today from Halifax. Welcome back to Nation of Nation, Miss LeMay.
Thank you. Thank you for having me.
All right, so I guess I'll start off what a lot of your recent column was about in the Hill Times, and that was a recent report that looks at how the RCMP interacts with homeless Indigenous women in Yellowknife. Was there anything in there that surprised you, or was it sort of what you already know?
To be honest, it didn't really surprise me, except for the quantity of racism that Indigenous women in Yellowknife who are homeless or housing challenged who were interviewed. Virtually every single one said they experienced racism and or physical abuse at the hands of RCMP officers or knew somebody who did. They used words like apathy, indifference when needing support from the police. The police weren't there, but yet they somehow also experienced this level of racism. And it seems to be almost systemic. I think that's what surprised me is that there has been no accountability, no change in the RCMP. This is not the first report. This is one of many reports that talks about the level of racism that Indigenous peoples face by the RCMP.
That leads me to the next question, which is, of course, is the you talk also about the RCMP's Civilian Review and Complaints Commission. Why do you think this commission is ineffective, and how do you think it could be changed to be effective?
Well, the RCMP does technically have civilian oversight. There is the Civilian Review and Complaints Commission. Most police forces in this country have some type of civilian oversight, although most in Canada are using a bit of a review model after the fact. After the crime committed, alleged crime committed by an officer, a commission might come in and ask for more detail. In the RCMP's case, they asked the RCMP for more detail to do a self-investigation. That seems to be completely evading responsibility. And so I'm not surprised that Commission for the RCMP has never laid charges. They don't have the legislative authority to do so. But Canada overall, we need to do better on demanding oversight by our police forces. They work for us, and yet they seem to be just beyond accountability.
That brings me now to, of course, training, which is something you talk about as well. Right now, I think my understanding is I think at the RCMP depot in Regina, they get about 6 weeks of training, and then they're sort of sent into out into one of the communities, I guess, that the RCMP serves. How do you think that could be better done in order to sort of to cause better interactions, I guess, with Indigenous people?
There's a number of police colleges or colleges that offer police training. The RCMP all goes through the depot in Regina. It is a 6 month training, although 6 months compared to a lot of other professions, doctors, at least 4 to 6 years to give ethical services. And mental health professionals, at least 4 to 6 years. And police would be dealing with a lot of Canadians struggling with mental health. They're probably not even trained anything in mental health behaviors, how to be supportive. We have one of the lowest training regimes in terms of time and quality in most of the G20 countries, except in the USA. And we can do better. We can expect more from police officers. They should have at least a 4-year degree. That includes sociology. That includes how to work with people with mental health challenges. That includes knowledges around trauma-informed care so that they don't trigger Canadians who might be suffering trauma, that they don't do more harm. And so in essence, we've been training officers who are not ready for the position. And I feel for officers that don't have this training. We know how to do better. We just are choosing not to.
Is it perhaps maybe time to move beyond the RCMP, that to have this brings into Indigenous policing as well. There's a big movement for that and a desire to have local Indigenous police forces serving these communities that the RCMP now serves. Is it maybe time to move on to that and move beyond the RCMP because maybe the force is just, there's too many structural problems?
Well, the RCMP certainly has a weight of reports, numerous reports around all sorts of dysfunction and lack of accountability. The federal government, who should be demanding accountability, hasn't done so. Even in this most recent budget, there was something, I don't know, maybe 40 million to strengthen the officers' training on how to deal with hate crime. And that's it. This federal government has not prioritized the RCMP's quality at all, nor has any in the last, as far as I know, as far as I can remember. Is the RCMP's time over? Well, I wish that we would be able to look at some of the best practices in First Nations policing. Here's an example of officers who are based in community, who are then models in community and have a vested interest. One of the weaknesses in RCMP is simply that these officers are moved around all the time. They never build relationship. They never have that vested interest. Is that model working for us? I don't think it works for anybody. Is the RCMP's time over? I don't know if anybody would argue that is the RCMP's time over? Well, I'm saying there was a best before date, and I don't know anybody arguing to keep them.
Yeah, it's an interesting discussion for sure that I think that will be carried on in coming months. But there's also, of course, as you know, this resistance for Canada to maybe change this mythical police force that was kind of created on a myth in a way, and bring change to it. They do have power, but it should be interesting to see what happens in the coming months.
Well, thank you, Fraser, and thanks for giving time to this urgent need that we need to look at in Canada. So I hope that we can see a shift in RCMP and policing for cultural competence, for every Canadian to feel safe and to trust the RCMP or whatever police force we have. Thank you.
That concludes this week's episode of Nation to Nation. If you missed any part of tonight's show, you can check out our podcast at aptnnews.ca/podcast. I'm Fraser Needham. Good night.